Did you know that, according to an estimate by the Ministry of Health, in Italy 10–15% of women of childbearing age suffer from endometriosis, a chronic inflammatory disease that is often not yet easily diagnosed? Let's see together then how you can recognize, deal with, and cure this disorder. Hello and welcome to Med4Care. Today we talk about endometriosis. But what exactly is endometriosis? To understand what we are talking about, it is necessary to take a step back and understand the basics of the functioning of the uterine cycle. The reproductive life of the woman follows an approximately monthly rhythm, which serves to prepare her for a possible pregnancy. This cycle is regulated by hormones which have the important task of synchronizing the activities of the ovaries with that of the uterus. The task of the ovaries is to produce an egg cell which can eventually be fertilized by a sperm and give rise to an embryo, while the endometrium, which is the inner lining of the uterus, must be ready to receive any fertilized embryo, accept it and feed it, supporting its development from the beginning to the end of pregnancy. And how does the monthly preparation of the uterus for a possible pregnancy take place? In the first phase, before the ovulation, the endometrium fills with blood, thus growing in size, thanks to estrogen. In the second phase, following ovulation, estrogen is reduced and the main hormone becomes progesterone, which maintains and stabilizes the endometrium by enriching it with sugars and making it welcoming for the eventual arrival of the embryo. If the egg is not fertilized, the progesterone level drops drastically, thus indicating the endometrium to flake so that it can be eliminated through the vaginal canal, thus causing menstruation. After menstruation, estrogen levels increase again, starting a new cycle of renewal of the endometrium, to ensure that every month this tissue is fresh to welcome any embryo. Endometriosis is a chronic inflammatory disease characterized by the presence of endometrial cells, that are those that make up the inner walls of the uterus, outside their normal location. These cells, when this disease is present, can therefore also be found in the muscular part of the uterus, in the ovaries, in the fallopian tubes, in the bladder, in the intestines, and even in distant locations such as in the lungs. The problem with the wrong placement of these cells is that they receive hormones even if they are not inside the endometrium, therefore they grow in size and are enriched with nutrients and blood vessels, and then flake off as in view of menstruation, exactly as the twin cells present in the uterine walls. Not finding the outlet of the vaginal canal, however, once the cycle is over, blood and waste tissue remain trapped inside the body, causing severe inflammation. Inflammation, if unjustified as in this case, constitutes a danger, as it strongly damages the surrounding tissues. Furthermore, the presence of this powerful and painful inflammation repeated monthly for many years can cause numerous disabling symptoms, severe pain, adhesions caused by the presence of scar tissue connecting different organs, up to infertility. Currently, the exact cause of endometriosis has not yet been found. However, the most accredited theory, although not verified, is that of retrograde menstruation. Retrograde menstruation means that the expulsion of blood and waste material does not take place through the vaginal canal but could take the opposite route, for example through the fallopian tubes, thus reaching the abdominal cavity, thus spreading to unsuitable areas. Endometriosis can cause very severe pain located in different parts of the body depending on the location of these off-site endometrial cells. Unfortunately, these pains often prevent normal daily activities and significantly reduce the quality of life of those who suffer from it. Other common symptoms of endometriosis can be painful menstruation in 80% of cases. A very important symptom and one of the most predictive of endometriosis. Chronic pelvic pain, even not during menstruation. Pain during sexual intercourse, especially deep in 30% of cases. Painful defecation during the menstrual period in 10–20% of cases. Painful urination. Furthermore, another symptom is the reduction of fertility, caused by the adhesions and fibrosis generated by the endometriosis itself, but also by the influence that this pathology has on the secretion of hormones and on the immune system. Unfortunately, endometriosis is often not diagnosed before 5 to 10 years after the first signs. This delay often causes serious consequences on the quality of life of women. Why is diagnosis delayed so much? The causes of this delay can be the absence of precise tests, inadequate visits and erroneous diagnoses, intermittent use of hormonal contraceptives causing temporary disappearance of symptoms, the lack of consideration for women's pain during menstruation, considered as normal by mothers, family doctors, gynecologists, and other specialist doctors. The certain diagnosis of endometriosis is difficult. For this reason, the international guidelines advise doctors to carry out a careful anamnesis of the patient, highlighting all the symptoms that may indicate the presence of endometriosis. After listening to the patient and noting the symptoms, the specialist will carry out a gynecological examination. He may proceed with a transvaginal ultrasound to diagnose endometriosis and identify any cells and cysts affecting the ovaries. If this procedure proves insufficient, then the diagnosis will have to use surgery. A small cut will then be made in the patient's abdomen so that the surgeon can insert a small camera and visualize the abdominal contents. This procedure is called laparoscopy. When endometriosis is diagnosed, the specialist may prescribe painkillers and hormonal therapies similar to common oral contraceptives to make the pain less. If the disease is already in an advanced stage, it may be necessary to surgically remove the endometrial cells from the extrauterine sites and resolve the adhesions. Finally, in the most serious cases, the removal of the uterus with or without preservation of the ovaries can be evaluated to minimize the progression of the disease. To learn more about the topic in our portal, you can click on the link in the description. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like, subscribe to the channel and click on the bell to be notified every time our new video comes out. See you soon on Med4Care.